Yeah. Okay. Okay, thank you, and welcome to this brief online session, introduction to our MSc in Health Economics and Health Technology Assessment. I'm Eleanor Grieve. I'm one of the co-directors of the MSc, and myself and Claudia just give you a bit of a flavour of our masters and some of our modules as well. So I'm a senior lecturer and I've been in HETA for about over 10 years now. And I'll give you a brief introduction to our team next on the next slide, if somebody's able to change the slide. Thanks. So yeah, HETA, we call ourselves HETA, and Health Economics and Health Technology Assessment. We're a very international team and multidisciplinary academic research group. We sit in the School of Health and Wellbeing at Glasgow University, and we're all active researchers in health economics and HTA. And we work on a wide range of projects in Scotland, the UK, internationally. We've got connections with the Scottish Government, UK Government, National Health Service, local authorities, private sector, and the voluntary sector as well. And we focus on research that really has a direct impact on clinical practice, population health and health policies, and both again nationally and internationally. And so we're really working to improve health and well-being through better evidence-informed decision making. So that's a little bit about our team. Our MSc in Health Economics and Health Technology Assessment has been running now 10 years fully online. And at any given time, we have about 35 students enrolled across the different modules that we offer. You can see from this little graph that most of our students are already working and doing this part-time, but we do hope that this might change a little bit going forward in attracting more students from their undergraduate courses, directly from undergraduate courses, and also having the facility to do it full-time as well. And also to say that our students are a very sort of diverse internationally as well, across Latin America and America, Canada, Europe, Africa. We have a few UK, but probably the UK is in the minority in the nationalities of our students. Yeah, sorry, it's fine. Next slide's good. Yeah. So why this particular program? So I would say that our MSc in Health Economics and HTA is a broader program than some. So for example, you could do an MSc purely in health economics, but we reflect the multidisciplinary nature of HTA in our studies and our modules. For example, we teach on the different types of economic evaluations that you can undertake, medical statistics, qualitative research, to name but a few. So it's a sort of more multidisciplinary, broader program than maybe simply doing one that maybe just focuses purely on health economics. And this then is reflected on our learning outcomes as well. And so yeah, we've got our learning outcomes here. So I'm sure you can read this yourselves, but it's about analysing policy and principles and methods and analytical techniques appropriate for health economics and HTA. We look at how we evaluate the policy context and how this differs between different countries, regions in the world. These are some of the methods that we go into: health economics, statistics, evidence synthesis, decision analytic modeling, economic evaluation, patient reported outcomes. These are all key elements of undertaking health technology assessment, and we cover the whole methodological range of tools that are applied. It's very much about being able to critically assess the research methodologies used in informing priority setting and decision making in healthcare systems. And we sort of develop original and creative approaches to translate policy issues into research proposals to assess health technologies. So these are kind of our official learning outcomes. And I should also have said from the last slide as well that we do have a lot of students from other masters, in particular the masters in public health, but they're global mental health, global health, and they can take modules as well as part of their master's program. So that adds more diversity and different backgrounds and a way of increasing that sort of diversity in the class. And then career opportunities. So we really want our teaching and our qualifications to appeal internationally and really, promoting its relevance to the career enhancement of a diverse international group of students. And indeed, the relevance of health economics, resource allocation, priority setting is more important today than really it ever is, or ever has been, in terms of countries, facing economic challenges, and really, if countries are unable to spend more in healthcare, they need to be able to spend better. And so our course, we feel, really equips students to rise to this challenge and ensure that investments in health continue to strive for improving overall population health. So I'll hand over to Claudia to go more into the program structure.
Yeah. Thanks, Eleanor. Yeah, so my name is Claudia Geue. I'm also a senior lecturer in the Health Economics and Health Technology Assessment team. And yeah, similar to Eleanor, I've been there for quite a number of years, stopped counting, I think. So yeah, so the program structure, so Eleanor has kind of shown it already on the on one of the first slides. We offer three different pathways, basically. So a PG, cert, postgraduate certificate, postgraduate diploma, and then the full MSc. And then depending on what students choose, there's different requirements. So it's for the PG cert, you would do 60 credits. So that's the 3 core courses, which I'm going to introduce in a moment. And for the PG dip, you would add 60 credits doing optional courses. And then for the masters, there's also a research project or dissertation worth 60 credits. So our core courses are here. So it's health economics, health technology assessment, health technology assessment policy and principles. And then a new module, which we will run from next academic year, is research methods for health economics and HTA. And then if people are doing the full masters, there's also the project dissertation for the MSc. We do have a number of optional courses, and as I said, students would need to select courses worth 60 credits. So we do have some which are worth kind of 10 credits, but most of them, as you can see from this list here, are 20 credits. And again, we're kind of covering a range of methods and areas in HTA that kind of cover the main methodologies and main areas that we are working in. It's also reflecting, so most of our, well, all of our teaching is really very research-led. So we are all active researchers. So we kind of try and make kind of really good connections and provide good examples from the research that we are doing ourselves. So the courses kind of really also reflect where we are active as a team in terms of research. And then these are just some examples of research projects that students have undertaken over the last years, just to give you a flavor of what these could be. So most of our students, as Eleanor said, do work full-time and are doing their master's part-time. And they're quite interested sometimes in doing a project or a dissertation on something that's quite relevant to their work or their employer. But again, you can see it's quite a mix of economic evaluation, systematic reviews, value of information analysis, cost effectiveness studies. So we're very open if students come with their own projects, because I think that's usually the best way of doing it. It's relevant to something you're already doing. So the master is a fully online program, as you might know. So the way this works for our program is we provide recorded lectures. So there's material or teaching material released every week on a Monday. And then a 20 credit course runs for 11 weeks. And of those 11 weeks, there's 1 week where there's no new material, and that's the reading week. So it kind of runs over 11 weeks with content for 10 weeks. And we, in addition to the material we provide online, we are also offering live Q&A sessions throughout the 11 weeks. We have weekly discussion forums where the module lead or the academic lead for that particular week is quite active, but it really relies on students to engage and pose questions, answer questions. So we try and encourage good use of the weekly discussion forums. We provide journal articles, electronic books, and other resources. You can download the teaching content, teaching materials for them to be available online, offline. It's really accessible, the platform that we use across different devices. We, as a team, we also invite all students to attend our internal seminars or team presentations, and some students find that quite good in terms of kind of understanding what we as a team are working on. So we open up our seminars for students to join. And then we also offer the option for students to present their dissertation project to the team to receive feedback. So the option is there as well. Here we've just put some quotes from our recent graduates. So 3 students who've recently graduated, who just give kind of their impression, and just got a few quotes here for you to look at. There's a fuller video of all 3 of them going to appear, I think, next week on our website. So if you're interested, you could have a look there and see the full video of those 3 former students. And that kind of concludes what we wanted to say, and we just wanted to leave some time for questions if there are any. So thank you very much.
Thank you so much, Claudia and Eleanor. Well, I just want to ask, one of the questions that we generally get is how many hours a student needs to put in every week, given the fact that some students might potentially be working full time. So what is the time allocation that they need to put in to successfully complete the program?
So the 20 credit module, we always say, has what we call notional learning hours, and a 20 credit module has about 200 notional learning hours or notional hours. So I'm not entirely sure. Yeah, so it's probably about 20 hours per week. So if students are doing it part-time, we recommend only to do one module per semester. So 120 credit module per semester.
And given the fact that a lot of students would prefer to network with other colleagues, so is there any opportunity during the program to network with other professionals in the field, like conferences or webinars that happen on a constant basis?
So no, it's a really good question, because we're aware that students that study online, there can be this issue around how do we promote the student experience, how do we make students feel that there's belonging to this group when everybody's online and in their own countries and their own places of study or work. Yeah, so we do try and make students feel very inclusive to our team by inviting them to seminars and webinars. Everything is open to our students. You do find that we've got group work as well, and that can link up students are more centrally in the School of Health and Wellbeing. For students doing their dissertations, there's kind of get-together sessions, which is led by one of our digital health colleagues, just to try and promote this sense of belonging, but I think it's something that we all kind of need to learn, and how best to do this. But we're very conscious and aware of trying to promote opportunities for students that are online and wanting to sort of come together and have peer support. So and yeah, but we, as I say, we try as a team to make students feel part of our team in HETA. We do this through live sessions, and you find that students will hook up as well through their WhatsApp groups and things. So and then if we're traveling and going to conferences, we'll reach out. I've met students when I've gone to conferences abroad, and that's always lovely. And so we do try and create this kind of ability to network as well, even though people are online.
So, are there any questions in the chat? I've shared some links in the chat as well, specific to the program as well as specific to online distance learning.
Yeah, thank you. Yeah, no, just to say, if people who are listening to this now or later, if there are any questions remaining, or if there are questions coming up later that you're thinking of, just drop us an email, and yeah, we'll be happy to have like a one-to-one chat with you if you have more specific questions. We do offer Zoom calls if you are still kind of deciding whether that's the right program for you.
Perfect. Thank you so much, Claudia. Thank you, Eleanor, for your time, and to all the participants as well. Thank you so much for your time.
No worries.
Thank you, Anna.
Thank you. See you
Thanks.
next. Bye.
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 Bye.